Welcome back to Wellness Wave Radio. Thanks for tuning in this morning to ride the wave with us. Each week our goal is to give you at least one suggestion that will make your life a little better. My name is Phil George. I'm a clinical biochemist, certified personal trainer, and health coach. Please remember, everything we discuss in the show is for informational purposes only and should not be taken as medical advice. Always seek the guidance of your medical professional. How many times have you heard that?
Hundreds. At this point, hundreds, and you have it down pat, Phil.
I didn't look at you because you're going to make me laugh.
Looking at you.
So I'm here with a repeat guest, Dr. Emily Cabrera. And Dr. Emily, can you please introduce the audience to yourself?
Sure. So I'm Dr. Emily Cabrera. I'm a psychiatric mental health nurse practitioner, and I am the owner and main practitioner, clinician for my own business, Dual Minds Integrative Psychiatry, which is out of Worcester. And, you know, trying to heal the world.
One patient at a time.
One patient at a time, which is working because we have a lot of really great things coming up, you know.
And you kind of specialize in first responders because we have a lot of connections with that. And that's a whole other show. And we kind of had a show with Jamie was sitting here, and we kind of talked about that before. But we only have half an hour, so you and I are both excited about one thing, and that is called, ready? We know this fancy word. Say the fancy word.
Transcranial photobiomodulation. I have said it in my head to practice thousands of times, so that way I don't mess it up. TPBM.
And this is exactly what it is. And actually, I've been using this for at least 10 years, and there's newer versions of it. What it does, basically, a little bit of the neurochemistry of this. So one thing, see if you remember the answer to this. What percent of your body weight is your brain?
Oh, I don't know that answer.
2%.
2.
But it uses 20% of the energy. So your brain is a huge metabolically active. It is a big energy hog. And what happens, going back to the listeners' high school biology, the mitochondria, the powerhouse of the cell. What happens, the mitochondria, they in order to make energy, ATP, which is the energy molecule at the very end, basically the mitochondria have to work very, very well. Again, I'm going to jump ahead. So the very last part of the mitochondria is called the electron transport chain, and it's called cytochrome C oxidase.
Yep.
It's kind of like a windmill. So the electrons go, it hits the windmill. If you don't have enough electrons, the windmill doesn't turn. If the windmill doesn't turn, you're not making ATP. You're not making energy. That's why.
And then they come to me. Brain fog, forgetfulness. You know, the consequences of not having enough energy, you can only give so many pills, supplements. Like if the core cells aren't doing their job, then we need to fix the root cause, which is what integrative psychiatry does. So this is right up my alley, targeting that ATP, mitochondria.
When Dr. Emily and I were talking and I introduced this, she got really excited because what happens is, obviously, she can sit down with you and talk to you and walk you through it. But again, if the brain isn't working correctly, it's again, you can't think of things. And I remember we were talking about somebody actually. We do seminars at the Greendale Y, and I remember this woman saying to me, I just can't pull that word anymore. My brain, it just isn't working. What happened is, you're not producing the ATP. So what this does is the light, it's a very, very particular frequency, and when this red light goes and it actually penetrates the skull. Let me see if I can, let me plug it in. I'm gonna, let me see, press this button. Let's see, yeah, there it goes.
Don't look into the red light.
Maybe you can see it. There's red light right here. That was dumb. I shouldn't have done that.
Where all of the blue, circles are that go on the head, that's where red light beam is coming out. And it's very different than, say, you know how you can play with your cats or your dogs and you have the little red light that you can press and they jump around on the ground and follow it. This is a totally different focus and frequency of the red light and the infrared light, because there's both setting on these helmets, right?
Right.
Can you talk a little bit about that?
Yeah. So there's two. One of them is called a gamma, and gamma is a very particular. In fact, EEGs, which I know you've been at work in the hospital, they put these sensors on your head, and they can see how your brain waves are going. There's gamma, there's alpha, there's theta. There's all different brain waves. So what this does basically is it gets your brain. It's called entrainment. It gets into that particular. So it puts your brain into this gamma state, like when people are meditating, they could be in theta, So all of a sudden, they can actually see that on an EEG that it's changing. And this company that we use, V-Light, is tons and tons of research behind it. What happens, and I'll let you address, because I know you're doing more research coming out of Harvard and places like that in terms of, and this has been around for a really, really long time. So what they used to do up in Canada, this is a medical device in Canada, I showed you pictures of this, they would have a huge hall. Have you ever seen people when they're doing chemo or they're doing things like that, they all line up and they have these things and they have sitting in chairs. So they had the same thing was happening in Canada. And they would have people sit there, and they would have have these particular helmets on their head. But let's face it, coming to this clinic over and over again over a period of time, it got a little bit, time consuming. So they make a home unit of this, but this is very expensive.
Very.
The other thing is people, they don't know if this is even going to work. So what Dr.
But there's been a lot of research, showing that if you get to the point where you can do maintenance dosing, meaning you can do this at home, then it does work, but for people who want to stay off medications, and you have to kind of think about what is your end goal. There's no guarantee with anything, including medications. So I don't know, I guess you have to figure out, do you have the money to support it? And do you have the ability to maintain it? Maybe we can do this for a certain number of months according to a protocol in a clinic, and then you'll feel good for a half a year, and then maybe you have to come back, or you buy it yourself and you continue it. You do the maintenance dosing at home.
Yeah, but before you have to buy it, you want to see if it works.
See if it works.
But the other thing is, we do an intake because there's something called counterindications for it, and that's your specialty. So we would send you basically a sign-up sheet, and you have this condition, what kind of med you want, and then Dr. Emily will figure out if we need to do anything else, or maybe this isn't appropriate for you. But we talked before the show, and if you have a loved one, a husband, a wife, or a parent, and you can see the memories going, and you don't know what to do, we have tons of research, and we can send you all the research papers out of Harvard, MIT, and all the rest of these places. This has been around a long time, and it's getting better and better and better. And what it does is, why don't you address you said you saw a study about them actually cutting down on so the amyloid plaque and the tau tangles is kind of the indication of dementia and Alzheimer's. And what was this?
Yeah, so I think that one of the things that I love the most about this device is it's non-invasive. So aside from just a little bit, assuming you meet the criteria to be able to utilize
Which
it,
I'm saying like 99% of people will. That's very rare.
Assuming. This isn't just a free-for-all. But, the benefits are so unbelievable because it is non-invasive. People can use it to help with cognitive fogging, Alzheimer's, dementia, concussion therapy, traumatic brain injuries.
Let me interrupt you.
Yeah.
This is used in all major sports.
Yes.
The
NFL uses it. The Bruins use it.
Everybody, they use this. So if you've had a concussion, and we talked before, there's a very famous neuroscientist, his name is Daniel Amen, and we talked about this before. I fell out of a tree when I was like 10 years old. You fell out of a tree. You don't realize that you've actually probably have some kind of brain damage.
Yes.
And that's what my wife says. That's my excuse.
Maybe. My husband might have some brain damage too. But your brain is very resilient, but it takes a long time to heal. So take first responders, right? I'm just going to focus specifically on police. They get beat up by the people that they're trying to protect. They get whiplash from getting in car accidents. There might be times when the police officer has to hit the other car in order to get them to stop. They might have been in the military and say they were deployed and they had, you know, the bombs go off. What are they called? It's an abbreviation. Oh,
Yeah.
You know that
Put
they're
this- put
buried
this
under the
helmet on.
ground. Yeah, I'm blanking on the name, but anybody watching this should probably instantly know. What I'm talking about.
IEDs?
IEDs, yeah. I'm thinking hospital land. AED is what we zap people to
Yeah,
bring them
yeah.
back to life, but
All these acronyms.
yeah, right. But you know, all of those cause special, unless you had primary trauma where you had a laceration to your brain. The thing that is the worst is secondary trauma to the brain, because that usually creates some kind of inflammatory process. And then you have swelling in your brain. You might have bleeding in your brain, and then that squishes your normal structures. And that can really take a long time to heal. So, you know, if you're the 13-year-old playing football and you're getting concussed, you should be worried about that 20 years later, because your brain is probably still healing. So anytime a client comes in, and I think even for a second, oh, they're a first responder, have you ever had a concussion? So if it works for the NFL, why wouldn't it work for, you know, psychiatry? Like, they're there because they don't feel right, usually mental health, and it might not be something that they control. This might be a biological issue. So you can just, you know, tell by all the things that we talked about, like what you can use it for. The sky's really the limit when you're focusing on a neuro perspective. Of course, they have different protocols according to each diagnosis, and you really need someone who knows what they're talking about. But
That's why we do the intake with you.
yes, exactly.
Because you're going to
Yeah.
come in and Dr. Elmer's going to say, how can we help you? What's
Yep.
your problem? Well, I got brain fog. I can't remember things. And then we go through the whole thing. Did you fall? We go through the whole thing on that. And then we figure out what particular frequency
Yeah.
is going to work for you.
Yep.
Again, you need a professional basically to figure these things out.
And if you're just a normal Joe Schmo who's just really healthy and you want to maintain your health, especially cognitive health, you can still use it. There are protocols that you can use. You use it every day.
I use it this morning. I use it every other day, and I've been
day.
using it for
Like 10 years?
yeah, at least 10 years.
Wow.
Okay, I'm going on. I'll be 80 years old this year. Okay, and
Yeah.
you've known me.
Our producer is going, woo!
You've known me for a while.
Yeah.
And you're a psych. What are you, a psycho? A psycho
Have
what?
I diagnosed you yet?
Yeah. So, again, do you see any neurological damage in me? Okay.
Very clear. No cognitive.
Okay. Again, so I'm not saying, I think this is part of it. I lead a very
Yeah.
clean life. I eat.
Yeah.
I'm obsessed about what I eat. But I think this is a good part of it. And again, we talked before. I'm also a health coach. So if I come in here and I'm 300 pounds and I'm going like
we
this,
got to talk about diet and other
I
stuff.
said, this guy, how can this guy help me? He can't even help himself.
Yeah.
The other thing we talked about, unfortunately, because even though it's been around for a while, people are very slow to change. The expression in medicine or science is that science and medicine progresses one funeral at a time.
Unfortunately.
Because people, they don't like to change. So your physician, I can almost guarantee you, has probably never even heard of this. Okay.
Probably. Yep. Or is so skeptic because it hasn't been indoctrinated and engrossed in the normal protocols. And I can understand that. There is a ton of research on this. It's just a matter of have they been exposed to it. So, like there's the research that people use if they have maybe an alternative look. There's a lot of research on diet and different supplements, but that doesn't necessarily jive with Western medicine. So that's why, some people might not understand that this is even available. So I'm really excited because my population specifically within my clinic is a really at-risk population. They on purpose are looking for a reason to not seek care. Whether they're ashamed with a possible mental health crisis that they're having, they don't want people to look at them as if they are less than, because they're supposed to be the saviors. First responders are there to help people, not receive help themselves. So if I can find a non-invasive, heavily researched, this is backed by the NFL. They use this with special forces in the military. There are some really heavy hitter entities that are using photobiomodulation. This is just one example of that, is the transcranial, but the red light therapy that you can put against a wall or over a door.
And we have that too.
We have that too, right? And that can produce infrared rays as well. Am I saying that? Rays, that's not the right word. Wavelengths?
Yeah, wavelengths,
gamma?
yeah, sure.
Is that gamma?
No, it's not gamma.
What is it?
It's 850 hertz coming out of it.
Hertz, yeah. So those are non-invasive strategies, and people who are just healthy can use them, let alone get the benefits of having some kind of psychiatric mental health, dysfunction. But
and again, I think the other thing is because it's not a pill and because it's not a procedure, they don't want to know about it.
Yeah.
It's not going to be really be promoted. It's not covered by insurance. So that's the
But
other
we do
issue.
have, a process. Sometimes this can get really expensive, but we have a process within our business model, is that if you can't afford the full cost, because this stuff, it's out of pocket, and some people don't have the means for that, but you have your FSA, like you can use your health benefits. Sometimes they give you the credit cards that have like $1,000 a year or whatever it is. You can use that to help pay for some of this treatment, or you can sign an application with us, and we do like a scholarship program to try to give people discounted rates.
Yeah, we want to make it
Affordable.
available to everything.
Yeah.
Other thing, I know Art's listening. Art, my timer went off, so you give us a heads up when we got a couple of minutes left, because we want people to get the right information. I don't want to run out of time. Again, the whole point of this is that, again, it certainly worked for me, but again, if the NFL's looking at it, and the Bruins are looking at it, if professional athletes are looking at it. The other thing we were talking about, I've got a good friend at Worcester Academy, and they're playing football and stuff like this. Yeah. If you got your athletic department and they want to contact us, we can go in there
do
and
some
do
seminars,
it and do it.
Yeah.
But I think the big thing is, and I see people panicking all the time. There was a very famous, it's on YouTube all the time, her name is Mary Newport, and she was a neonatal pediatrician, and smart bunny rabbit, and she had all these connections, and her husband, who was an accountant, she could see he was going. And this is way back when, and what she did is she went, she found this research company that were like trying new stuff. So there's something, what they give a test. What the test is, the cognitive.
You're talking about the Montreal cognitive?
Yeah, the MoCA. And
assessment.
Yeah, the assessment.
Montreal cognitive
assessment. Yeah. And anyway, so they went in there. In order to get into the study, what you needed to do is you needed to have a certain score above that you're not. And he didn't qualify because his MoCA score was too low. So, but she's a smart bunny rabbit. So
she started to do this?
She started looking at something else. Basically, it's what it is. It's ketones.
Yeah.
That's another way to do it. She did ketones. She found out it was basically ketones. Long story short, she gave him a bunch of ketones. He got a lot better, and that was one way to do it. But this was not part of the mainstream. But again, I would think, and we haven't talked about this yet, a ketogenic diet along with this could be a real killer.
Yeah.
So, and again, that's one of my things.
That keeps you alive.
Yeah.
Yeah, but that's part of it, is like people just are saturated with so much of Western medicine, which is, good to keep us all alive, and it really fails us with preventative medicine. And what we are talking about is trying to calm the storm that might be going on in your brain, decrease inflammation, target that mitochondria and ATP process to give us more energy. Your brain needs that. It has a high metabolic rate. If you don't have enough of that, no wonder you have cognitive fogging, right? So if we can do some proactive rather than reactive interventions, Why not? But you're not going to hear it from your primary care physician.
They're going to say to you, just because you're getting older.
Yeah.
And don't ever take that.
Mark, if you're watching this, reach out to us again. He calls into the radio station all the time.
But the other thing is, I'm talking about mitochondria, power hustle the cell. You lose 1% of the efficiency of your mitochondria after the age of 20. So as you get older, you are going to eventually start losing. I mean, your brain, your muscles, you're not going to be able to do the same thing when you were a young girl like Emily. Anyway, so the whole point is, this actually is a prophylactic measure.
Yeah.
Because what's going to ramp up that mitochondria in your brain. So if you're a high-performing executive or something like that, or you just want to stay on top of your game, because the only thing that really differentiates us from the animals is this. That's really what, that's, in fact, they found out the #1 fear that people have when they get older is not cancer or heart disease.
Losing their marbles.
It's losing the marbles. I don't want to have my kids be changing my diapers. I don't want to be a burden on my family, because it's so sad when you've known somebody, a parent or something like that, and you've known them for the whole life, and all of a sudden they don't know anything. They can't even function anymore. But again, you don't want to wait.
It's hard. It is a burden.
But you don't want to wait.
Yeah,
you
we
don't
can
want
be
to wait.
proactive.
Be proactive.
Yeah. Listen, I'm ready. Sign me up. You're going to cure me, huh, Phil?
But this is, I mean, when Dr. Emily, I started talking about this and I introduced this to her, she was like, she gets, I get a constant, did you know this? Did you know that this, and this? So we're both scientists. So we don't take anything lightly. We make sure that there's evidence behind it and that it actually works. The other thing is, I like to say, is our reputation is the most important thing. It's the most important thing. So I'm not going to recommend anything that I don't use myself. And I know it's hard to believe, Dr. Emily, but I have been wrong on occasion. I know it's hard, but I have
Not
been.
that many times, right?
But anyway,
Yeah.
that's the whole point, is that, if I'm wrong, I want to know about it. But I'm not going to recommend something to somebody. And I have friends and families that I recommend this to.
For me, my primary goal in psychiatry is to minimize suffering. There's a lot of suffering that happens with mental dysfunction. I hate even using the word. I hate even using. Did I twist that the first time? Maybe I'm having cognitive fog.
I think it sounded okay.
Okay. I hate using the word mental illness, because then that stigmatizes what's going on in your head, for many people suffering with it. It's really suffering. And often the go-to in Western medicine, just because this is an integrative approach, right? Or unless you get on some kind of study that they have all this funding from Johnson & Johnson or Big Pharma, something, you're going to get this through integrative therapies. But the answer usually is to put them on a psychiatric med, an SSRI, antipsychotic sometimes. There are just a handful of really go-to classifications that psychiatry uses. But the list is endless. And then that impairs the person. And then they don't, feel themselves, and they lack emotion, and they become walking zombies sometimes.
And they lose their libido too.
Yes, they lose their libido, and then it truly affects their whole life, sometimes, these psychiatric meds. So I love this for that. It will decrease some of the suffering. It keeps them maybe off of medications. I use a multi-layered approach like you do. We talk about diet. We talk about supplements. I get every one of my patients on supplements. And 9 out of 10 times, I can keep them off of psychiatric meds, just off of supplements. But supplements won't fix a concussion.
Right.
This will heal a concussion, right? Or this will help support the delaying of any dementia symptoms. And when you're in the throes of dementia, anything is better than nothing, to have a quality of life. Like you had said, that's the worst case scenario. People don't want to lose their marbles. Well, if we can prevent or slow down that process, you have a better quality of life. For me, that suffering is number one. I want to prevent it, and this is just a modality that I think will really, really help with that. So I can't wait till it comes in the mail.
Right. The other big thing is almost the whole thing with diabetes, a lot of people don't know, is there's something called it's insulin. It's not high blood sugar. It's insulin resistance. And basically, 10 to 20 years before you come down with type 2 diabetes, your insulin is through the roof.
Yeah.
So again, with this, if you start noticing, geez, where did I put my keys? What did I do? This, and then it's just, something's happening. So again, since your brain, in my opinion, anyway, it's really the most important thing.
Which is hard because then you go to your primary care physician or nurse practitioner or somebody within, your regular office that you're going to, and they say, oh, okay, well, let's start you on metformin. Instead of fixing the root cause, there's no time and there's no money to do that, just because we have a very dysfunctional system that nobody can argue with me about that, because that's the truth. Like how many times people have been put on wait lists or really disappointed with their care, so then they go and they find another one. I can't think of anything better with these scenarios that we've been talking about that will really get to some of the root cause and fix it before it's a problem. You know what I mean?
Right, it's just like, again, we're using a multimodal approach. So the other thing, they're calling now Alzheimer's dementia type 3 diabetes.
Type 3 diabetes.
Because
right?
again, it's the sugar. So it's not only, you're going to get, we kind of team. Emily does some things, I do some things. So my role is kind of, Emily will also do nutrition, but my role is kind of like the nutrition part.
Yeah.
So I'm going to sit down, we're going to do this, then we're going to say, what's your diet like?
Yep.
What's this? We talked about, you don't have to give up your sweets, because we talked about it in the car. On the way in here, we have a glycine and we have allulose. It's natural, but it doesn't raise your blood sugar, but you don't have to give up the sweets. But a lot of people don't know that. They just don't know it. So the whole point is we're going to be able to, the other thing is I'm also a certified personal trainer, so we can also do the exercise component of it. We can get you on doing, I like to call it exercise snacks.
Yeah.
We did that in the show before. You do a couple of, I'll show you that. You can do it at home. You don't have to join a gym. There's different things you can.
Something is better than nothing. Anything. You know what I mean?
2 minutes?
We're getting near the end.
We covered a lot, though. So the whole point is, again, if you want to try this, this will be coming in within the next week or so. We'll have this. But if you want to get on the list, because I'm sure we're going to get a long wait list, so the best thing to do basically is to contact us now. We'll put you in. Then we can set you up with an assessment and everything else, and get you and get you going. We also have other what they call biohacking devices. We have something called a vagal nerve stimulator.
Yep.
That
Got 3 of those coming.
Help calm you down. We have
Hopefully.
a whole. This is going to be the ultimate place for wellness. It's going to be cutting edge stuff. Because I'm a biohacker. I mean, I'm into all of this stuff. But it's all based. But you're not going to hear this probably anywhere else. This is going to be the place to go.
A little overwhelming, but it's exciting. I'm excited as a scientist, as a practitioner, as a mom, as an empath. I'm ready to do this with my children. I care that much about it, and myself and my husband.
There was stuff too to do with kids on the spectrum, right?
Autism.
Yeah.
It helps with autism, and there's. I just read another study talking about impulsivity and outbursts from kids that are on the spectrum. So you could even put ADHD, I think, in that bubble, because many autism and ADHD symptoms are shared between the two. If you can keep them off of med like guanfacine, any autism family would know guanfacine.
Okay, we got to wrap it up. Okay.
Yeah, keep them off.
It works for everything. Okay. So you can email me, philgeorge@charted.net, and Dr. Emily, how do they reach you?
www.dualmindpsychiatry.com.
Okay, guys, thanks so much for tuning in. Email us if you want any other information. Bye.
Bye.